Hello, everyone. I'm Dr. Sandeep Sharma, and we have a very special guest with us. INI SS November 22 results have just been announced, and we have Dr. Kiran with us. She has got a rank of 11 in the INI Super Specialty DM Neonatology division, and she is soon going to be a neonatologist from one of the top central institutes in the country. So we welcome Dr. Kiran to the interview. Congratulations, Dr. Kiran.
Thank you so much, sir. I'm very grateful for your.
Yes, yes. Thank you so much. Thanks for the wishes back. And how are you feeling right now? Has the feeling sunk in, or you are still coming to terms with it? Because the result has just been released a few hours back only.
Yes, sir. Yes. Yesterday evening only it has released, and I'm like very grateful for it. And I have not thought that it will be like this, but I'm very happy right now.
Great, great, great. So before we go into the nitty-gritty of the exams and how did you prepare, can you just briefly tell the viewers about your background, from where you belong to and from where you did your MBBS and your MD?
Yes, sir. I have done my MBBS from Government Medical College, Bhavnagar, from Gujarat, and I have done my MD from BG Medical College and Civil Hospital, Ahmedabad, Gujarat.
Hmm. Okay. And right now you're working somewhere, or you have finished MD and like preparing for the exam only?
I have done my 1 year of senior residency after the completion of my MD, and after that I have took 2 months of break before NEET SS exam. Right now I am not working anywhere.
Okay. So if I'm correct, you had messaged me some months back also. You appeared in NEET SS. That was your first attempt. And I remember that you
Yes,
got a rank. It was a good rank, but it was not sufficient for you to get a seat of your choice. Am I correct?
yes, sir. Yes, sir. Yes, sir. I have got 124th rank in NEET SS.
Great, great. And this was your first attempt in INISS?
Yes, sir. It was my first attempt in INISS.
Okay, so let us come to the thing which students will be interested in knowing. There are very few resources or public information or recall papers available for INISS. How did you prepare for INISS for the super specialty exam? And what were the resources, the books that you followed, which proved to be useful in the exam?
Okay, so for INISS, it was like 80%, 70 to 80% from the neonatology, and 20-30% was from the general pediatrics. So I have done for neonatology, I have done AIMS protocols and Cloharty, and some topics from the Nelson also.
Mhm.
And for general pediatrics, I have took the subscription of the PrepLadder, and from that I have prepared for my general pediatrics.
Okay.
And for NEET SS, I have done from general pediatrics and from Nelson also.
Okay, nice. So you have given both the exams and you have been a ranker in both the exams. The weightage of the exam is obviously very different. So if somebody is preparing specifically for one exam, do you feel the preparation is different for INISS versus NEET SS?
No, sir. Like in NEET SS and in INI SS, the questions were like more like clinical. So
Mhm.
you have done, if you have done your residency well and you have good clinical rounds, then and along with it you have read the Nelson, then it is good. You can give the exam and you can get the good rank.
So we are seeing a common pattern that the exams are becoming more and more clinical in nature. INISS
Yes,
always,
sir.
before that AIMS SS, it always used to be more difficult compared to NEET SS. But now, as you are saying, the exams are, both of the exams are clinical based. Any specific areas which are more frequently asked other than the specialty part in INISS compared to NEET SS?
In INISS, ventilation part and acid blood gas analysis parts, they are more frequently asked.
Okay, okay.
Otherwise, they are from the
Otherwise,
subject only.
if a student is prepared well, I think he should be able to do questions on both the sides, right?
Yes, sir. And
So,
it is more from the common topics.
okay, okay. The INISS exam, right?
Yes, sir. Yes, yes,
Okay.
sir.
Even in neonatology, the AIMS protocols were helpful, as you said. What were the areas in neonatology, more questions you found from a particular topic? Like usually when we are reading, we have a tendency to read more about neonatal jaundice, resuscitation, and hypoglycemia and congenital infections. Was it the same this time also, or was the pattern slightly different this time around? In the neo
Those topics were there. but there are more questions from the hearing loss, like when will you do the screening and how will you follow up the patient. 2 or 3 questions from that single topic only,
Okay, okay, okay.
and
So
a follow up of the high risk newborn baby.
yes, yes, yes. This thing has been told by multiple students who have given the exam. Those who are targeting the INI SS exam, high risk pregnancies, high risk babies, and their follow up, including the hearing assessment and the various assessment methods that you do, the screening methods that you perform. The Even in the previous INI SS, what I've heard is more and more questions are being asked from those areas. So people who are targeting INSS, please take note. You should be targeting those areas as well. So tell me, Dr. Kiran, when you were doing your MD, when did you decide that, okay, now need to get serious about targeting super specialty exam? When did you actually start preparing for the exam?
During my MD, I have not thought like I will do the DM Neonatology. I have planned like I will do the fellowship mostly after doing my senior residency. But at the completion of senior residency, I was like I will give one attempt to NEET SS.
Mhm.
After giving the attempt, then I have decided this February only that I will prepare for the DM Neonatology. And so after that, I have given NEET SS and INISS
Great, great, great.
after doing my residency only.
Okay, nice. And did you do the MCQ practice also? What was the source of MCQ practice that you did for the exam?
I have practicing from PrepLadder app, and there is no such material for MCQ practice. So it
Mhm.
is difficult to do MCQ practice. But I have given the question and grant test of PrepLadder.
Okay. Did you find them useful, the resources at PrepLadder,
Yes, yes, sir.
the
It
videos,
was very helpful.
the videos, the Q banks and all?
Yes, sir. Yes, sir. Very helpful.
Great, great, great. And like, what are you planning to like? Which institute you are going to take up it at AIMS if you get it, or you are going to take up in PGI or some other
Yes,
place?
sir.
So you'll be
Aims, sir. Aims.
AIMS, AIMS. Great, 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 great. So, what were the things you feel that you could have done better? Like when you prepared, obviously you have got a very top rank in the exam, but what are the areas you feel if you have to appear again in the exam, you will be focusing on those areas? Mistakes you would advise to yourself to avoid if you are sitting again in the exam.
To practice more clinical MCQs and like area like neonatal sepsis, specifically fungal infection and all that culture report. How will you manage that all that part? I will.
Okay, okay, okay. And did you read any journals? Because again, it keeps recurring that for INISS you need to read journals. What is your take on that? Did you read journals? Did you read the latest
No,
guidelines?
sir. I have not got the time that to read the journals.
Mhm.
I have done books only.
Okay, so books are good enough. So people who are targeting the exam, see, knowledge never harms. But end of the day, if you're thorough with the books and you practiced well and you are dedicated and focused enough, you can crack the exam just like our topper has done here. So in the end, any people who have not done well in this exam, what advice would you give them other than number one, two, three, four? What are the areas they should be focusing on? If especially if they are going to appear in the next INISS.
It needs more revision than more topics. There are same topics, but you have to revise more and do much MCQ practice for that topic. And area like tubular disorder from the nephrology and hearing assessment from the neonatology. Like common questions are repeatedly asked. They are asking most common questions.
Great, great, great. Did you appear for the departmental assessment part also?
Yes, sir.
And any tips for that? Because there is very little information in public domain available for those who appear in that exam. Like, how was it
Uh,
like?
in uh, in departmental assessment also they are asking clinical questions. They are giving the scenario and you what will you do next, what will you do next, that
Mhm.
like.
And did they ask
And
in?
it was
Mhm. Please, please, please continue.
for that also I have read the AIMS protocol.
Okay. And do they ask about, like, it's a common conception in the students that they ask a lot of details about your thesis topic, and they do ask about the biostats also sometimes. So did you also encounter similar questions, or it wasn't the case in your case?
They this time they have asked one question regarding the biostatistics,
Mhm.
not regarding the thesis topic.
Okay, nothing related to that. Okay. So people who are
Yes.
targeting the departmental assessment also for super specialty at AIMS, departmental assessment is like a, second stage that you have to appear, and that is like a filtration stage. After that, the ranks are released. Those who have given the exam previously, they would know. So our topper has just shared some insights into the exam. Be thorough with the AIMS protocols. They are going to be very important for the INI SS exam. And lastly, somebody who's just entered into MD, what is your advice? What are the books they should be focusing on? Obviously, Nelson and Cloharty. Anything else, because they have 3 years while doing the residency?
If they are doing with the residency, then it will be more easy for to clear the exam. And for the books, I have same Nelson, Cloharty, AIMS protocol for the NICU and the PICU.
Great.
Same. And some part for the cardiology from the park,
Okay.
common CHDs.
Okay. 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 So, in the end, Dr. Kiran, would you like to dedicate this success to anyone special? Your family, your friends, any shout outs?
I'm very thankful to my family and my friends, my seniors and my juniors, my great teachers who taught me much during the rounds, during my residency. All that were very helpful during the exam.
Mhm.
After watching your videos, and it was very helpful and it was very inspiring. After that, I have planned, let's see what try for the NEET SS, and after that, I have joined the PrepLadder and start studying. And it was very helpful during the preparation part also. Like it was very sometimes you like whether to give the exam or not, and it was very helpful from the PrepLadder to give you that boost you needed at that time.
Thank you. And in the end, on behalf of the entire PrepLadder Super Speciality team and myself, we all congratulate you on your success, and we wish you all the best and you do well in the field of neonatology. So, wishing you great success and a great future. Thank you for your
Thank you
time,
so much.
Dr. Kiran.
Thank you, sir.